Alrighty, good evening, everybody. Thank you so much for hearing the call to action. This is Wisdom Cole. I serve as your Senior National Advocacy Director, and I want to thank you so much for joining us on short notice that this moment calls for. We're going to give it a couple minutes for a couple more folks to join. While we're waiting, feel free to drop in the chat where you're calling in from. If there are other member leaders, other members in your branch, colleagues, friends, neighbors that you think should be on this call, definitely feel free to share the link with them. Right now, we got about 310 people on the call. We want to continue to increase our impact. So feel free to share with a friend, tell a friend to tell a friend. We'll be starting in just a couple minutes. Shout out to, I see Virginia here, Detroit, North Carolina. We got Sonoma, California, San Diego's in the building, Kentucky, Redford, Michigan, Phoenix, Arizona, and so much more. Feel free to keep flooding the chat with where you're calling from, and we will get started in just a moment. Alrighty, welcome everybody who has joined the call. I see the chat still flooding. I see Washington, D.C., uh, Virginia, Los Angeles, California, Louisville, Tennessee, Colorado, New York, and so much more. Again, my name is Wisdom Cole. I proudly serve as the Senior National Advocacy Director for your NAACP. Thank you all so much for heeding the call tonight and joining. We got 352 people and counting who've joined us tonight for this rapid response briefing. We want to make sure that we are giving you the most up-to-date information, particularly on the government shutdown. This evening, we want to make sure that we are bringing together our policy experts, partners, and leaders to talk about how Congress is moving forward with the government funding deal that doesn't include the Affordable Care Act. I want to say this very clearly. Lawmakers are negotiating a shutdown fix that leaves out the ACA protections, the very protections that millions of our family members, elders, students, and neighbors rely on each and every single day. So what's at stake is not abstract, it's not partisan, it's not political strategy. What's at stake is healthcare access, affordability, and survival of our community. We want to make sure that we are taking action. Shout out to everybody who joined today to call their legislator. Every phone call counts, every phone call matters. We want to make sure that we are clear about what's going on in this moment in time. And so as we wait for our leaders to join, I'm going to pass it to our chief of field, Mr. Dominic Whitehead, just to give us some about what the state of play is. We just are coming off the heels of a local election in an off year cycle. And so we want to talk about some of the wins that we've had along the way. Dominic Whitehead.
Thank you so much, Wisdom, and good evening, NAACP partners and allies. Dominic Whitehead, Chief of Field here at the NAACP. Thank you all for joining this call this evening. We know typically we like to get these invites out a week or two in advance, but given the current times and what is happening, we thought it was very important to bring this body together this evening and truly give folks a briefing of what is happening. And so you're here, as Wisdom mentioned a moment ago, from some of our policy experts, our Chief of Policy, Patrice Willoughby, our partners on the Hill, Executive Director of the Congressional Black Caucus, Mr. Vince Evans, and others throughout the evening, talking about what is happening in this moment. As we are on this call right now, we know that the House is set to make a vote in the next few moments, and this vote will likely not include health care, the Affordable Care Act, but reopening the government, but not including health care, where we know millions of Americans are depending on the ACA and will likely lose health care. And you hear more from Patrice and team around what that means in this evening. But what this means right now Last Tuesday, we saw something amazing happen across this country. We saw so many people stand up from across the country, from Virginia to New Jersey to New York to California to Detroit, and so many places in between where we've seen record levels of turnout. Not just record levels of turnout, we've seen a pushback on this current administration, the current Trump administration, if you will. Now, you know, NAACP is nonpartisan, so throw that in the chat. We are nonpartisan, but we are not blind. We are not blind in this moment because we know what is at stake, whether it be healthcare, whether it be reproductive rights, whether it be immigration rights, but it's happening across the country, whether it be jobs, whether it be the economy. We know what is at stake. And voters stood up last Tuesday in several states across the country and said, no, we're not going to continue to deal with this. Voters stood up in California and said, no, you're not going to steal the 2026 elections, and we're going to make sure there's fair representation across the board. And so, as we're having this call this evening, we want to make sure, as the NAACP, we're going to continue the momentum that we've had. We recruited well over thousands of volunteers going into last week's elections, where folks made phone calls, knocked on doors, sent text messages, focused, did poll monitoring, focused on our voter protection, our election protection program, where we saw some good victories, right? In Virginia, where we saw this first woman governor in the state of Virginia, in New Jersey, right? Where we saw, again, as I mentioned a moment ago, Proposition passed in California, the first African American mayor in the city of Detroit. The list goes on and on and on, and what we saw. And so, in this moment in time, we want to make sure we're continuing to meet this moment past election day. So, oftentimes we think our job is done on Tuesday of election day, but we know we have to continue to advocate. We know we have to continue to hold elected officials accountable in terms of the work that we're doing. So, after all of that momentum that we had last week, we're asking folks to stay in the fight and stay encouraged. We know what Congress have did in the most recent days, whether it be the U.S. Senate and or whether it be the House of Representatives, who are about to take a vote in any moment now, but maybe while we're on this call this evening, we cannot be discouraged, right? We have to continue to stay on the front lines and in this fight and continue to hold folks accountable, because we have a lot of work to do as it leads up to 2026. 2026 is here. It is here. Folks are mobilizing and organizing. I think about our national campaigns team, who's going to be working with many of you over the next few months to begin to get folks ready to go and engaging voters around, from voter registration to volunteer recruitment to voter turnout to voter education to mobilization. We need folks in this fight in this time. So whatever happens between now and this call, with the votes as it relates to healthcare, as it relates to the government potentially reopening, we have to continue to press forward. I saw someone wrote progress is the NAACP. We have to continue to press forward. We have been around 116 years. It'll be 117 years in February. We are ready for this moment, and this is our moment. And so we're going to take the energy that we had from last Tuesday, and we're going to take this energy into the next fight ahead around that. With that being said, Wisdom, I kick it back over to you for the call. I don't believe the President and CEO has joined yet, so I kick it to you, and we'll move through the call.
Appreciate that call to action, Dominic, as well as the state of play. We definitely recognize the power that we have in this moment in time. And so as we continue on our agenda, I want to turn it over to Patrice Willoughby, our Chief of Policy and Legislative Affairs, to give us the current state of play as those votes are currently taking place as we speak.
Hey, good morning, everybody. Good afternoon, actually. Good evening. You know, this is how hard we've been working. We don't know what time of the day it is. But thank you so much for being on the call this evening. I will make this brief because I have my brother in the fight here, Vince Evans, on, and I know that he is watching the House floor because the House of Representatives is taking this vote even as we speak. But back in 2010, many of you may not remember, or you do remember, there were over 40 million people that were uninsured. And when we passed the Affordable Care Act, 2013, it began to take effect, and many people were able to get health insurance. Part of that program requires that tax credits are extended to people that reduce the cost of healthcare. Healthcare is still too expensive, but in July of this year, Congress chose, and the tax credits expired in December of this year, as well as the tax cuts that were passed in 2017. Congress chose to extend those tax cuts, but not the tax credits. And so we have a system right now that is not benefiting average and everyday working Americans. The government shutdown ensued, and for the past 44 days, people have been fighting to ensure that healthcare remains affordable. Part of the deal that is being voted on right now does not include those tax credits that are so needed to keep healthcare from increasing in cost by 2 or 3 times. And so this is what's at stake. The deal that has been agreed to would have a vote on those tax credits sometime in December, but that's not what we need. We need for people to raise their voices and let their elected officials know that their needs are paramount and that we expect Congress to move forward on those tax credits to ensure that people have access to health care. And I'm going to pause there and allow my brother in the struggle, Vince Evans, to take up and tell us what is going on now in Congress. Vince?
Well, thank you, Patrice, and thank you to all of my friends at the NAACP. So many of these folks on the call I know, but for those of who I don't, I'm Vincent Evans, Executive Director of the Congressional Black Caucus. And, Patrice's comments are timely. As a matter of fact, y'all, I am sitting right outside the House floor right now as we speak. You can't maybe see it, but just over my shoulder is the chamber where this vote that Patrice is talking about is taking place. As I walked off the House floor to join you all just now, the vote was 180 to 178 for those who are voting in favor of it. And so we expect in just a few moments that this vote will pass and the government will reopen. But what that means, to the point that Patrice just made, is that so many people in this country are going to face real hurt if we do not do something to fix healthcare in America. Tonight's vote will reopen the government, but to the point that Patrice made, it will mean that the tax subsidies that have underwritten the Affordable Care Act and given so much opportunity and lifeline to people, your premiums are going to go up. And let me just be clear that it's not about just those who are in on the Affordable Care Act. All of our premiums are going to go up, even those of you who have insurance through your employers. And so this is a real challenge here. The Congressional Black Caucus has fought the entire time over these past 40 some odd days now to ensure that we did not get here tonight. We have been out of session for 54 days. If y'all can imagine, this is the first time that we have been in session in the United States Congress in 54 days. We've come in here tonight taking 2 votes today, and then members of Congress are going to go back home tomorrow, back to their districts. Now, you name a job in America where you can take off your job for 50 some odd days, come in, do something real quickly that the Republicans are doing tonight, and then just go straight home like nothing ever happened. What we do right now is ready for the next fight, because the next fight has to be, what are we going to do to hold to account the people in this country who are doing everything they can to rip healthcare out of your hands? So many people are facing double and triple and quadruple in terms of what their premiums will be. There are families, we heard today, who were paying $800 a month for their health care for a family of 4, and now it will be up to $11,000. Can you imagine what that could mean? People won't be able to literally afford, and they'll have to make the impossible choice. Do I have health care or do I not have health care? And let's be clear, that's what this was always about. This was always about an attempt to undermine the Affordable Care Act, what they call Obamacare, because they never had any intention on ensuring that it would work for everyday people. So we got a lot of work to do. One of the things I'm going to ask tonight, because folks, number one question, they call the Congressional Black Caucus and they say, What can I do? So I've got to ask for you tonight that I know my friends at the NAACP will help with, and we're going to do this on Monday night. We want to hear the real stories of people who are affected. So if you or someone you know has received already, and in most states you have, what your premiums will be next year, and you have seen a dramatic increase, any increase, we want you to send your story in. Send it in to the NAACP, and they're going to share with us here at the Congressional Black Caucus, because we are going to spend every day between now and December, when we get another vote on a potential vote, or a vote, they say, in the U.S. Senate. We don't know if we're going to get the vote in the House. We're going to talk about and read the stories of real Americans who are facing this crisis, because we have to put a face and a name to what we are talking about. These are not just numbers; these are real folks' lives. So please, if you've got a story, please send it in to our friends at the NAACP. They're going to get it to us here at the CBC. So that we can tell the story of those who are most affected. So I appreciate y'all. Let's stay in the fight, y'all. We got to keep fighting between now and the end of the year to do everything we can. So thank y'all. Thank you, Patrice, and the entire NAACP family.
Thank you, Vince. Wisdom, back to you.
Thank you so much, Patrice. Thank you so much, Vince, for that information. I'm feeling fired up. I hope you are all feeling fired up. This fight does not stop. And we need to make sure we are telling the stories. We need to make sure that we are messaging appropriately, which leads us to our next speaker. Would love to bring up Trevon Williams, our Senior Vice President of Communications, just to talk a little about the messaging in this moment.
Thank you, Wisdom. Hoping you all can hear me okay. I'm having some technical difficulties here at home, but good to be with you all this evening. Listen, to much of what has been lifted up by my colleagues as well is that it's absolutely vital for us to ensure that we are sharing the story and the message of how these things are directly impacting our communities all across the country. And so, to the point that Vince just made mention to, and to what you're going to be hearing from my colleagues at the NAACP, we want to make sure that you are sharing those messaging and those points, really about the impacts of this on your whether it be your family or those who are surrounding you. Whenever possible, we want to amplify real stories so that the real impact of those things can be heard and felt from across the country as well. After I'm finished concluding here, I'm working through my technical difficulties. I'll drop in the chat some messaging talking points for you all to be able to reference as well, along with the public statement that we made after the original Senate vote as well. Once the vote that Vince spoke to as well is concluded, we'll make sure to put out an additional statement related to some of the correspondence that is taking place with regards to this procedure as well. But at all times, what we want you all to be doing is utilizing talking points, utilizing the information itself that we make available to you all, and sharing as much as possible. Your NAACP is looking for that information so that we can amplify it as much as possible. And the point that Patrice and Vince both lifted up is absolutely vital. This is about accountability. That, as was made mention to, 40 plus days. When's the last time you saw somebody be able to take 40 plus days off of work and just come back whenever they feel like it? It's not real. It's not possible. It's our job to hold legislators, lawmakers are responsible for the things that directly impact us. And this is your opportunity to do so. And we're going to apply as much pressure through the amazing work of our field advocacy team, through the amazing work of our policy legislative affairs teams, and through the amazing work of your communications division back on those individuals as well. I'll drop some information here in the chat here momentarily as soon as I get my phone together and make that available to you all in real time. But let's make as much noise as possible, and let's make it as uncomfortable for those who seek to undermine us as much as possible as well. With that being said, I'll drop it back over to you, Wisdomir.
Thank you so much, Sharon. Appreciate that information. We definitely want to make sure we set up that opportunity for folks to collect stories and to continue on there. We want to open it up to the members. If there are any questions, feel free to drop those questions in the chat. We want to be able to provide you with up-to-date information there. Amari, are we getting any good questions that we want to uplift?
So we're trying to track them in the chat. If everyone could please add your questions to the actual Q&A portion as the chat is moving. I do have one question from Parker Brown Jr. How do we hold legislators that sold us out responsible? So how do we hold legislators responsible for their vote this evening? And I'm kicking that to the panel.
I think that regular and ongoing connection with legislators is important. Legislators listen to people who barrage their office with calls and emails and also convey those personal stories. Many times, what happens is that they operate in a vacuum because when people are happy and things are going well, they don't hear from anyone. And so they don't know that people are actually watching what they are doing. I think it's incredibly important when you don't need things that you are in touch with lawmakers. And when you're angry with them, it's even more important that you are letting them know how they are not serving your interests. All legislators have financial pressures. If you have the ability to go to fundraisers, to let them know, what that you are a constituent, you should do that too and support your Congress people, but also hold them accountable and stay on the phone and stay in their inbox, and let them know what you expect from them.
The
And
other,
then register everybody to vote around you. Make sure people go out to vote.
if I may add, Amari, the other piece I add to that, Patrice, is, and I think folks should know, and I know everyone on this call know that, but they work for us. They work for us, right? And so when anybody that that work for me, in that place, you hold folks accountable nonstop. You not just make those phone calls. These folks have in-district offices, right? U.S. senators have several district offices. Most of them have 2 to 3 district offices in the state. Congressional members, of course, their district offices are in the district. As NAACP leaders and/or partners on this call, you all can organize yourselves. You can go directly and demand conversations with your congressional member, demand conversations with the staff. The member doesn't have to be there; it still have to be on record. And so you can meet with staff as well in terms of holding them accountable. The other piece I will lift up around that as well as today. We took action today, right? We had well over 500 plus folks from our campaigns and an advocacy team today in the middle of the day on the call, taking action and calling into Congress around this very vote right here. And I'm going to just throw a plug in to make sure you're going to continue to take action with us. And Amari or someone, you can write it in the chat. We're going to continue to talk about it throughout the night. Text sign up right now. Sign up to 20707. Sign up. SIGNUP. Real simple. SIGNUP to 20707. And you can continue to take action with the association. You can continue to get updates in real time, but you should be doing this day in and day out because advocacy is 365 days of the year. We cannot stop at election day, people. We got to continue to keep our foot on their necks because they got their foots on ours.
One thing I would also add as well, I saw in the chat that someone mentioned Congressman Mike Turner from Dayton, Ohio, who has been running from a group of constituents. All of the elected officials now are very sensitive to social media, and what happens in darkness, often goes unchallenged. So if he's not meeting with your group, I would tweet and post about it, and tag him in the post as well because many elected officials don't like to have negative exposure and social media in the media. And so I would ask them directly on socials, why won't you meet with your constituents?
Thank you, Patrice, Dom, and team. I think the next question is how are we planning to put pressure on Congress? How are we planning to put pressure on Congress and senators to address this ACA fight? And I'll kick that back to you, Patrice. I think you answered it in terms of it's time for us to start making sure that we're holding them accountable and making some of those phone calls and ensuring that they are hearing our voices in terms of how their vote impacted us and how they should move forward. I'm going to see if I see some more questions. I see one is what is the strategy for 2026? And I think they're talking about the races that are happening next year. And I think that's something that the campaigns team we are currently working on. But I will kick it to you, Tyler, as the lead of the campaigns team on what are we doing moving forward for 2026 as we know that elections are coming for next year.
Thank you. Thank you very much, Amari, and thank you everyone on this call. I see a few things in the chat. Some folks are putting into the chat, sign up 20707 into the chat. I hope you are doing that to promote the sign up word. When we say text the word sign up. It means take your actual phones out. If you're on the phone on this Zoom, you can pop out of the Zoom screen. We want you to text the word sign up to 20707. Promoting it in the chat is really wonderful, and hopefully everyone is getting that number, but we need each and every one of you to actually text the word sign up to the number 20707 to join our rapid response team and be up to date and real time updates on what is currently happening. But to the question of how we are preparing for 2026, of course, all things at the NAACP and our campaign team starts with data analysis. So we start with our data analysis. Where are our targets? Where are our movable voters? Do we have the right phone numbers? Are we talking to the right people? I see many folks on this call that have been on our van trainings. They've done the phone banking. They've done our text banking, and now we're out back on doors in a larger way, knocking on doors. So we start with data analysis. Where are our voters? Then we move into mobilization and education, targeting the right areas, saying the right things, and having real conversations with voters. So we're data analysis. And we move into mobilization and education. From the education and mobilization periods, it is all about dragging folks to the polls. So it's keeping that consistent drumbeat. Many of you are going into the top of the year in your own state legislative advocacy seasons, your own state legislative advocacy. So how are we tying those issues that are so very pertinent to your local level to the federal ties? This comes with toolkits and talking points from the national campaigns team. But if I had to put it into like a three-step outline of what it would be, it's data analysis. Where do we need to be? Are we providing everyone with the right tools and research and messaging and talking points to mobilize folks and get them to the polls? And that third piece is really be present, be in the moment with us, show up to our activations, be engaged in our power hours, and get with your local NAACP unit so you can knock on those doors. So we have a full wraparound approach what is moving into 2026, but it doesn't start in July. For the NAACP members, it doesn't start after convention. It starts now. It starts at the top of the year. It starts in your state legislature, moving through into these federal elections that we see that are happening in 2026. So that is the wraparound approach to the civic engagement work that the national campaigns team does here at the association. Just one final plug before kicking it back to Amari. That is text the word sign up to 20707. Thank you.
Thank you, Tyler. I'm looking through, and some individuals are saying, how do we hold those who are not up for election accountable? I think that goes back to what Tyler and Patrice both said. We have these advocacy days at the state capitol, and that information will be coming out to ensure that you're engaging and having those conversations in person with individuals who have an impact on your daily lives when it comes to legislation, as well as holding them accountable by making those phone calls to their offices so they can hear from their constituents directly. So making sure that you are making those phone calls to them directly to voice your concerns as a unit to ensure that their voices are heard. Patrice, I think this one may be for you. Some individuals just want to know a little bit more about what does it look like when these adverse effects. So someone says, can someone give us an example regarding a specific issue where individuals are adversely affected by the lapse of ACA? I think individuals want to see what is the impact or what exactly is going to happen now that this has passed through.
Sure. So the way that insurance works is that it spreads risk across a large group of people. And then so that makes the costs go down for everybody. With these costs doubling and tripling, what's going to happen is that when people have pressure on their pocketbook, what do? They pull back. They say, well, I can't afford insurance right now. So that makes costs even more expensive for everybody. With costs more expensive for everybody and people not being able to afford insurance, that means that you can't do things like go and get your screenings, go get your mammogram, go get your prostate checked, go for your well baby exams. That's what that means. And so illness can take place before you have a chance to actually catch it through regularly scheduled exams. That's a very concrete example of what happens when people don't have health insurance. And before the Affordable Care Act, what would happen is that people would not get to the doctor, they would show up in the emergency room. Well, what happens is that we all pay for that emergency room care instead of being able to go to the doctor on a yearly basis and get those checkups. That's really what is at stake because Also, your hospitalization. If you have insurance, your hospitalization is covered by your insurance. So, yes, you may have a copay or you may have some money out of pocket, but you're not going to be hit with the full cost of that care. A stay in a hospital can be upwards of $1,000 a day. And before the Affordable Care Act, people were being bankrupted by medical debt and medical expense because the hospitals, if you get sick and you have to go to the emergency room, they're going to pass along that cost to you. Same thing with ambulance rides. There are thousands and thousands of stories like that. So that's the purpose of insurance. One, when everyone's insured, the costs go down. Second, when people have emergencies, then they don't have that devastating financial impact. And third, you're able to get regular and ongoing care so that you catch something and you stay well instead of having to be treated for sickness.
Thank you, Patrice. And I see someone said, how can we canvass door to door with Van? If you if you type sign up to 20707, we'll let you know the next steps to ensuring that we are engaging and making sure that individuals are getting the word out and also are able to engage in those engagements. Patrice, I think this one is also for you. It's individuals are saying they are seeing the January 30th date. What exactly does that date mean, and what do we do until then?
So this deal that's being voted that just passed the House, it's only in effect until January 30th. And so that's for the fiscal year 2026. In January, this whole process starts again because the budget has to be voted on every year. It's the only thing constitutionally that Congress has to do is to fund the government every year. So this deal is in effect until January 30th. And then during December and during January, the process will begin again to fund government for fiscal year 2027. Every year, Congress works on a specific cycle, and that is the first Monday in February is when the budget is presented, and through the next 6 to 7 months, Congress is supposed to work through that budget and decide what money goes to what departments. And then at the end of the fiscal year, a vote is supposed to take place on those negotiations. And then Congress is supposed to agree to fund the government for the next fiscal year. This agreement right now, this is just work that is backlogged because they couldn't come to an agreement last year. And so this stalemate that we are working ourselves out of is because a certain number of members of Congress want to deprive people of health care. And then other groups, the Democrats put their foot down and said, no, you've got to fund health care if you want us to go along with this. And so until January 30th, this deal is in effect, and then it will start all over again.
Thank you, Patrice. And I see someone said, will retirees who do not pay be affected? And in kicking it to you, Patrice, about retirees.
So retirees are affected by Medicare funding and also Social Security. So Social Security has a cost of living adjustment that is decided every year. That's already been decided for the next fiscal year, and I think it's 2 point something something to adjust those Social Security benefits upward. Medicare is what's called mandatory funding, and so that funding is not part of the budget negotiation. However, all of healthcare is interconnected. And so what happens in Medicare always has spillover effects into what happens in the private insurance market and also in the way that the Affordable Care Act is implemented. But the Social Security cost of living adjustment has already been determined, and that will kick in January of 2026.
Thank you, thank you. And I see another question. How exactly do we are we able, no, I'm sorry, are we able to invite non-NAACP members to these mobilizations? Yes. Yes, these mobilizations are for all individuals to join us in the fight. As long as more people we have, the more noise we are making in terms of ensuring that individuals know exactly what's going on. They know how to mobilize their communities. I see. I believe that's it because I see another individual's asked, how do we hold those 6 Democrats responsible? Those phone calls. I think Patrice hit it earlier in terms of we need to make sure that our voices are heard by calling those offices to let them know that you did not agree. And even though their election may not be next year, you can still apply pressure to them, ensuring that they're still being held accountable because you put them in that office. We voted for those individuals. So making sure that they are still being held accountable. I do see some NAACP membership questions, but we'll answer those at another time. But also, when it comes to civic engagement and youth engagement, we need to make sure that we are including our youth in college with these conversations. So please do make sure that you're reaching out to the youth in college as you are doing these mobilizations. And then I believe that is it. Oh, I'm sorry. There's one more. And I think this is important, Patrice, in terms of this, how does this impact veterans and retired veterans?
So veterans, the bill that has been passed impacts 3 appropriations bills. One of them is agriculture, another is military construction, and the other is legislative branch appropriations. So funding for the VA has not been included yet, and so that funding would continue in the way that it was funded in the previous year. But you have to remember that in the tax bill that was passed in July, there were cuts that were put into the Veterans Administration and Veterans Health Care. And so those cuts are in effect as they were passed in July uh, of this past year. And so, what you will probably see is some retraction in the level of services that veterans are able to access from the VA because that was part of the big, horrible tax bill that was passed earlier this year.
Thank you, Patrice. I think I will kick it back to you, Wisdom and team.
Appreciate that, Amari. And thank you everybody for your questions this evening. Looking at our chat, it looks like we are coming to the end of our briefing for the evening. So I want to thank all of our speakers. Thank you, Dominic. Thank you, Tyler. Thank you, Patrice. Thank you, Vince and Trevon, so much for joining us this evening. We know the power is in our hands as the people. We want to continue to use our voice, make those phone calls and those emails, and stay engaged. We have more of a fight ahead of us in 2026. We want to continue to ride the wave of excitement and wins that we had during this year and continue to build power from the ground up. And so stay tuned, stay in touch. Make sure you sign up for those rapid response messages from the NAACP because we have a lot more in store. Thank you so much for joining tonight and have a good evening.